Good afternoon, fellow friends and loved ones. It's once again a great privilege and a great honor to come to your homes this calm afternoon. Yes, it's 2:30. It's once again a great privilege to come to your homes as we continue our discussions on various health conditions. Yes, the last week's discussion we had on a very interesting topic that was on we had on initially we had a ganglion cyst, and then just recently we had on Baker cyst. And so yeah, it's been gradually, I'll say, interesting. Yes, interesting. And this afternoon's presentation will not be an exception. It will be very, very interesting. Relatively short though. And so without much ado, we begin this presentation in the name of the Father and of the Son and of the Holy Spirit. Okay, so this afternoon's discussion is on a topic called Syndactyly. And then the normal or the layman's description of this condition is union of either the fingers or the toes, but most importantly, most in a high incidence, the fingers. So we have some of the fingers being joined together, which we'll be discussing into details in a very few seconds or minutes. And so it's also a congenital birth defect. So scientifically or in medical terms, we say it's a congenital birth defect. When you say congenital, it means after birth, or yes, it's a condition that is mostly in children. That's congenital. And when you say birth, I'm sure you understand the meaning of birth. That is, birth is when you give birth, yes, after the child is born. The process of bringing out the child forth out into the world is called birth. And defect is the malformation of a particular organ or structure of the body. So we say defect. So if you have the hand supposed to be like this, which is supposed to be like this, and it's like this and it's stiff, then you can see it's a defect. That is from the normal presentation. So this condition we're talking about, or we will be talking about, is called syndactyly or congenital birth defect. That's a broad term of the condition. You have so many congenital birth defects, that is in children. That's when they are giving birth. But this condition we're discussing this afternoon is actually one out of so many of them. Okay, so what is syndactyly? Yes, actually it's a condition that occurs mainly in children. Yes, so where we have some of their fingers joined together. And so under normal circumstance, when you are giving birth, a normal child should have both 5 fingers separated into, we say, web digits. So this is a web digit. So this part is called a web digit, and this is called a web digit. In between the fingers, we have something we call web digit. So this helps separate our fingers and helps to move them up and down. The other structures in the hand that's come together to ensure that we move our hands very, very effectively. So we have the tendons, we have the ligaments, we have the blood vessels, we have so many structures in the hand, and this helps to move the hand up and down. But then this joining of the finger, which is called the syndactyly, actually occurs as a result of non-differentiation of the fingers during birth. So this, under normal circumstance, from the 6 weeks of conception of pregnancy to 8 weeks, we have these bones beginning to differentiate or separate them. So during birth, the hand is all joined together. I mean, not during birth, that is when the baby is in the mother's womb. After conception, the hand is one, all the fingers are joined together like a ladle, are joined together. So nature or God has made in such a way that yes, you're supposed to have your fingers joined together and then have the space between. So this occurs from the 6th to the 8th week. But due to some other factors that we might talk about soon, maybe the mother's diet regimen, this causes the fingers not to separate, and so this mostly occurs in the middle finger and the ring finger. The other fingers could be affected, but mostly we see them in the ring finger and the middle finger. So in such a case, we opt for, as early as possible, treatment, that is through surgical means. Most, or if not all the cases where we have the bones joined together is sought for surgically, because it's very important that the bones are separated before the child grows, and so surgical means comes as a first point of contact when the child is seen that both fingers are joined together. So actually the incidence rate is such that it could affect both males and females, but research has shown that it affects more males than females. We are yet to have a very good study to really state, but outside that, the United States of America has stated that yes, it affects mainly the males. Okay, so as we said, it could affect the middle finger and the ring finger. That's the main finger that's affected. So we'll show you some pictures to show us and the condition itself, so we can appreciate it, because I'm sure we are talking, but then when we see pictures we can appreciate it the more. Okay, so when this is noted at the point of birth, yes, surgical intervention is taken as the first point of contact. In the case of from 0 to 1 year, yes, decisions are made by the surgeons, who decide on when and where to do the surgery. Yes, and so they take a portion of the skin. It could be from the elbow, it could be also from the wrist, which is a more probable area where they take to be able to separate them. So after separating the fingers, they attach the skin, which you call the flap, yes, to the region in between the fingers. So you realize that the palms structures are very tough. Yes, they are very tough. So when you don't put a very strong structure there, it might not be able to withstand pressures, and so the surgeons come into contact as early as possible. Yes, so we note that this is very important. Yes, this condition is seen between the first year and second year of the child's existence, or the child being born, and so we are very much interested in noting this instance. So from 1 to 2 years, surgery is carried out as early as possible. And so research that's in United States of America has stated that out of 2,500 births, at least one person is likely to have a syndactyly. And so, and then it stated that more Americans, or more persons that live in the Western world, are likely to have this condition as compared to those from the Asian or African descent. And so these are all research that has been carried out outside to give us this information. But then we have so many symptoms of this condition. These symptoms also differ according to child. So from child to child, we have so many different symptoms. But then we have three main types of this condition called syndactyly, or the union of the fingers or toes, or we can say congenital birth defects. So we have three types. The first one is the simple syndactyly, the second one is the complex syndactyly, and the third one is the complicated syndactyly. So the first one, which is the simple syndactyly, actually involves just the skin joining together. So you have the bones intact, so two bones intact. So you can see my fingers here, so you can have them joined together like this. The bones are already separate, you have two bones, but then the skin is joined together, and so these ones are quite easy to be able to separate them, and so they don't involve other structures that come to play. We have nerves and muscles and so many structures, so just the skin that's separating the two bones together. the muscles are all separated. But then the second type, which is called the complex syndactyly, actually involve the bones joining together. So we have probably the ring finger and then the middle finger joining together, and so it becomes a little bit difficult, which is still at the complex syndactyly. But then the third type, which is the complicated syndactyly, we have other structures. We have the bones, ligaments, tendons all joining together, and this makes it difficult for one to be able to have the surgery done, and so it's more complicated as compared to those of the simple and then the complex syndactyly. So the complicated syndactyly demands more work by the surgeon to think through, to be able to take other structures from other parts of the body to be able to separate these two. It's just like having Siamese twins and having fraternal twins, and so that's not quite an example though. But then we have structures joining more as compared to complex syndactyly, and so this type of syndactyly, as we mentioned earlier on, is from the 6 to the 8 weeks. So 6 to 8 weeks of birth, and that's conception, when the baby is in the mother's womb, these bones are supposed to separate. But then when they don't separate, they are likely to cause this condition called the syndactyly, or the union of the fingers or the toes. So it is shown that this condition is actually, it could be genetic, which has a quite higher percentage. So if your mom has, or man had syndactyly, when you are born, you are likely to have a syndactyly, but this actually is 40% chance. It's not really 50%, but a 40% chance. And this is also actually research carried out outside, so we can't conclude definitely for this percentage, but there's always a probability. And so you can inherit it from your parents, and so we say it's genetically related. So how do we diagnose this condition as congenital birth defect or syndactyly? This condition is noticed right after birth. Yes, so we can see it is something that is seen, but then the extent of the type of syndactyly is observed through other additional tests. So if we have the simple syndactyly, when we check through an X-ray or an MRI, specifically the X-ray, because we are more focusing on the bones for the simple one. So when the doctor palpates or checks the two bones and he realizes that they are intact, he might not really necessarily focus on the fact that it's complicated, because he can feel the two bones separated, and so he can just check an MRI to see whether the structures are also intact, or he probably just go through and have the surgery, yes, to separate the bones together, and then he or she can go, or the baby can go and return to normal. So if it's the skin is just separated, and then we have something we call grafting. So grafting is actually taking the skin from the part of the body. So you can take the skin from the elbow and attach to the fingers after he separates them. So the bones are like this, the fingers are like this. In the baby, you're talking about a baby. So the baby's hands are joined like this, and so he or she goes through surgery and separates like this, and then cuts it and then attaches the skin to this side, and then after a while the baby is able to move the hands and the fingers as best as possible. If it's complicated, yes, which is the extreme form, he or she takes an MRI, and then we can see the other structure that has been involved, and this is very critical, and so surgeons take very, very critical care in terms of separating these fingers. Yes, and so we give a kudos to our surgeons, and they are doing extremely well. Yes, and so they are doing extremely well. I'm sure we see some pictures. I've come across some conditions just recently in terms of some newborns having syndactyly, and it has been of immense interest to me, and our surgeons are doing very very well. And the current state that we mentioned, we have some Siamese twins also being separated at a rich hospital, and that's very great, and we are giving the kudos to our surgeons who are doing extremely well. Okay, so after they are separated, the physiotherapist also comes into place to ensure that yes, after separation the fingers are moving very very well, and we have treatments such as range of motion exercises, we have stretching exercises, we have picking exercises, so many exercises that the physiotherapist come to play, and this helps us to be able to ensure that the child returns to function as early as possible. So we've been talking about syndactyly so far. Yes, the condition in mainly newborns is seen in newborns, and surgeries are carried out in the first 2 years of after birth, and this is very very critical. So we need to ensure that yes, we take as urgent care, and when our children or any of your friends have this condition and surgery is being conducted, just know that yes, everything will be fine with the child, and success of this surgery is very 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 good, and then the child returns function of the fingers as early as possible. So we'll look at some pictures concerning this condition called syndactyly. So just a minute. Yes, so there are so many professionals that come into place in terms of having treated this condition. We have the surgeons, we have the physiotherapists, we have the occupational therapists, we have the nurses, we have the psychologists. We have so many professionals who come into play. So without much ado, let's look at some of the pictures concerning this condition. Okay, so this is called what we call the syndactyly. Okay, so I'm sure you can see now. It's very very visible. So you can see the child's fingers joined together. You can see there. Yes, so this is the child's finger. So this is a ring finger, this is a middle finger. It's joined together. So surgically there are so many ways. This is the simple syndactyly. You can see the two bones to get separated by the skin. Joined by the skin. The two bones separated, but they are joined by the skin. So this is the palm facing down. You can see the skin here. The web they get is actually supposed to be down here, but then it wasn't separated well during the child's conception. That during the child's birth, it wasn't separated. So we have our surgeons come into place to be able to separate them, and this is a simple type of syndactyly. So these are some of the surgical means of separating them. So you can see this is one joined together here. Yes, you can see it here. So they go to surgical means, and they can cut them out. They can cut them out as nice as this, and then after that they are separated. You can see this is the end of the separation. Okay, so this is also an example here. So you can see the fingers joined together. Yes. Okay, you can see this one and this one. You can see that stretch up a little. You can see that's it. And this is one here, the B. You can see the skin joined together, but the bones are separated. So this is actually also a complex, or we can say a simple syndactyly. So this is a simple syndactyly. Yeah, you can see a simple syndactyly. I'm sure you can see it very 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 clearly. Okay, so this is actually a complex syndactyly, where we have the bones in an abnormal shape. You can see this is also a simple syndactyly. Yes, so with an X-ray you can see the complex nature of the bones here. You can see. Yes, okay. So this is also this is one for the hand. You can see the fingers joined together, the ring finger and the index finger. No, the ring finger and the middle finger, you can see them joined together by the skin. And these are the toes. These are the middle toe and then the fourth toe. Okay, so these are all. So this is actually a very good annotated sketch of the condition. So this is a simple type, incomplete here. This is a simple type, complete. So you have the simple incomplete type, this is a simple incomplete type, and this is the simple complete type, and this is actually the complex type, and this is complicated. So the complex type actually has the edge joined together, and it could be that the bone can even fuse at the end. But the complex one is actually where you have the bones separated and they are just disorganized. So this is actually another type of syndactyly, which is a complex type. You can see it here. And another one. So this is the surgery done. So this is the initial part, and so this is after the surgery being set, the fingers being separated, and then you can see the wounds healed. They are healing here. You can see the fingers separated, and this is also it. Okay. So this is the toes. You can see the second toe and the third toe joined together, and this is actually a more complex one. Yes. So you can see this third and fourth toe being joined together and separated by the bones. So this is actually a marked out session to be carried out. So we are about doing the syndactyly separation for the ring finger and then the middle finger. So another one here, the incomplete syndactyly and the complete syndactyly. So you can see this complete syndactyly, you have the digates, as the web digates crossing up to the end, but the incomplete syndactyly is actually the web digates extend, but they don't extend to the tip that's around the near region. So you can see another one, the complex syndactyly here. So this actually is, we can see is an incomplete simple syndactyly. So you can see it here. Okay, so yes, so thank you very much. Yeah, I'm sure we've learned a lot. Some pictures giving us a very good presentation of this condition. So we're talking about a condition called syndactyly, or union of fingers or the toes, or we can say in a medical term, congenital birth defects. Okay, so I'm sure you've learned a lot, and if you have any questions, you can just push out on the question box. We'll be ready to answer you. If you want, you can also subscribe to the YouTube channel and then also watch other videos concerning other conditions, and I'm sure we'll learn a lot. And let's share ideas, let's share any question you want to ask. We are already willing to answer you. So thank you very much for your time, and we'll see you next week. Yes, next week, and then we'll bring you the next topic very soon. Yes, that will be posted on our Facebook wall right after. Have a blessed afternoon. May the good Lord be with us all. Take care. Love you. Okay, so I acknowledge so many people also came online. Sorry, so many people came online, and you can see Mavis, you can see Angel, I've had other people coming online. But then have a blessed afternoon. Take care. Love you. Bye.